Welcome to our hairdressing and barbering Level 2, Health and Safety course. Topic 1. Legislation, the Health and Safety at Work Act. Introduction. The Health and Safety at Work Act 1974 is the legislation that covers a variety of safe working practices and associated regulations. You do not need to know the contents of this act, but you should at least be aware of the existence of relevant regulations made under its provisions. They cover the following aspects of work. 1. Management of safety at work. 2. Safe equipment and systems of work. 3. Protective equipment. 4. Handling chemicals and substances. 5. Electricity. 6. First aid. 7. Handling and moving objects. 8. Fire precautions. The Health and Safety at Work Act 1974 is the primary piece of legislation covering occupational health and safety in the UK. Under HSWA, employers have a duty to provide a safe place of work and protect the health and safety of their employees and others that may be affected by their work activities. It also places duties on employees to cooperate with their employer, so far as is necessary, to enable their employer to comply with his health and safety duties as set down under HSWA. The Management of Health and Safety at Work Regulations 1999. The legal responsibility for health and safety rests primarily with the employer. It is their responsibility to ensure the organization has the necessary management framework to protect the health and safety of their staff and provide a safe working environment. This means taking an active role in 1. Carrying out risk assessments, which can be delegated to others. 2. Setting health and safety standards. 3. Monitoring those standards. 4. Developing policies. For example, where 5 or more staff are employed, employers must produce a written health and safety policy. The Management of Health and Safety at Work Regulations 1999. The main requirements for management of health and safety are 1. Identifying any potential hazards. 2. Assessing the risks which could arise from these hazards. 3. Identifying those at risk. 4. Eliminating or minimizing the risks. 5. Training staff to identify and control risks. 6. Regular reviewing of the assessment processes. There are special provisions for young workers at risk. When employing a young person, under the age of 18, whether for work experience, or as an apprentice, employers have the same responsibilities for their health, safety and welfare as they do for other employees. The Workplace Health, Safety and Welfare Regulations 1992 cover a wide range of basic health, safety and welfare issues and apply to most workplaces. The regulations are intended to protect the health and safety of everyone in the workplace, and ensure that adequate welfare facilities are provided for all members of a workforce, including people with disabilities. The regulations cover the following. 1. Maintenance of the workplace and the equipment in it. 2. Ventilation, temperature and lighting. 3. Cleanliness. 4. Sanitary and washing facilities. 5. Drinking water. 6. Rest, eating and changing facilities. 7. Storage of clothing. 8. Glazing. 9. Traffic routes. 10. Workspace. Under these regulations, the main considerations are 1. Ventilation. Workplaces need to be adequately ventilated with fresh, clean air. 2. Temperatures indoors. Offices for seated workers minimum 16 degrees Celsius, in places of physical exertion a minimum of 13 degrees Celsius. 3. Cleanliness. All workplace furniture, furnishings, fittings as well as surfaces of floors, walls and ceilings should be clean. 4. Lighting. The lighting should be sufficient to enable people to work and move about safely. 5. Workstations. They should be suitable for the people using them and for the work they do. Continuing with these regulations, the main considerations are: 6. Workrooms should have enough free space to allow people to move about with ease. 7. Floors and traffic routes. There should be sufficient traffic routes to allow people to circulate safely with ease. 8. Windows should be openable, transparent or translucent windows. Skylights and ventilators should be capable of being opened, closed or adjusted, and any glazed areas must be made from suitable safety materials. 9. Sanitary conveniences should be adequately ventilated, well lit with running hot and cold water with drying facilities. 10. Rest area and meals, where workers regularly eat meals at work, suitable and sufficient facilities should be provided. 11. Drinking water. An adequate supply of high-quality drinking water, with an upward drinking jet or suitable cups, should be provided. The Personal Protective Equipment at Work Regulations 1992. PPE is equipment that will protect the user against health or safety risks at work. Generally, it includes items such as safety helmets, gloves, eye protection, high-visibility clothing, safety footwear and safety harnesses. You are required to wear the PPE provided by your employer. So in hairdressing and barbering, your PPE includes: 1. Your disposable gloves which you wear to protect your hands. 2. Your apron which protects you from the splashes from chemicals. 3. Gowns and towels to protect your clients from accidental drips and splashes that might happen during services and treatments. Potentially hazardous substances used by hairdressers include: 1. Acidic solutions of varying strengths. 2. Caustic alkaline solutions of varying strengths. 3. Flammable liquids, which are often in pressurized containers. 4. Vapors and dyeing compounds. There are also potentially hazardous items of equipment such as electrical appliances, heating instruments, sharp cutting tools. Both hairdressing and barbering employers are required by law to make an assessment of all the chemicals that are used in the salon that could be potentially hazardous to staff, clients and visitors. The purpose of COSHH regulations is to make sure that people are working in the safest possible environment and conditions. A substance is considered to be hazardous if it can cause harm to the body. However, it only presents a risk if it is in contact with the skin or eyes, absorbed through the skin or via the eyes, from contact with contaminated surfaces or clothing, inhaled, from breathing in substances in the atmosphere, ingested via contaminated food or fingers, injected, or introduced to the body via cuts and abrasions. Manual Handling Operations Regulations 1992. These regulations apply to all occupations where manual lifting occurs. They require employers to carry out a risk assessment of the work processes and activities that involve lifting. So, what's the problem? Incorrect manual handling is one of the most common causes of injury at work. It causes work-related musculoskeletal disorders, often referred to as MSDs, which account for over a third of all workplace injuries. The regulations require employers to 1. Avoid the need for hazardous manual handling, so far as is reasonably practicable. 2. Assess the risk of injury from any hazardous manual handling that can't be avoided. And 3. Reduce the risk of injury from hazardous manual handling, so far as is reasonably practicable. Summary. In this session you covered an overview of the main regulations from the Health and Safety at Work Act for management of safety at work, safe equipment and systems of work, protective equipment, handling chemicals and substances, handling and moving objects,